The United States currently houses the world's largest prison population.
Los Angeles is home to the largest population of the formerly incarcerated in the country.
Sunshine in the grass, and the children play. Sirens passing, fire engine red. Someone's house is burning down.
Yet, when people think of the underserved communities, the incarcerated and formerly incarcerated are often ignored.
We are UCLA Prime, and Prime could be defined as the earliest stages or the beginning of something, and we are in the beginning of our careers. And I think all the medical students entering this year are at their prime as well. And I think it's important to share with our fellow colleagues and future colleagues the importance of raising awareness.
We decided to challenge ourselves and work with a population that a lot of us had very little experience with.
One of the main goals for our project was to impact the community that we felt was neglected. The incarcerated, formerly incarcerated population immediately stood out to us.
A lot of folks who are incarcerated in correctional institutions have a history of substance abuse, mental health problems, have had poor access to care in the past, and so when they come into a correctional facility, it's a potential public health opportunity for us to be able to provide them services, link them into care, identify whether they have infectious diseases like HIV or hepatitis C, which they might be at higher risk for if they have a history of injection drug use or if they have had unprotected sex. Folks definitely have a higher burden of disease. Folks who are incarcerated, there's a higher prevalence of asthma as well amongst people who are, at least in California state prisons, very high rates of hypertension as well, and diabetes. And so folks who are in our prisons and jails, even though they tend to be a little bit younger than the general population, average age in the California prisons is about 36, they still actually have quite a tremendous amount of disease.
This project because we wanted to have an impact not only now but also in the future.
We thought about doing a selective because it's part of a bigger educational effort. We thought about doing direct service, we thought about a lot of different options, but for us, the way that we could really best leverage our resources, our connections, our connection to UCLA was through something that could really educate other students.
By training future doctors to be more sensitive to the needs of this population, the patients will feel more comfortable in releasing information that will lead to a more accurate diagnosis.
I think the thing that we can learn the most is that there are a lot of neglected communities out there. I think when we originally were brainstorming and thinking of ideas, we kept doing a lot of disadvantaged communities that a lot of us worked with in the past. So the homeless population, children, certain ethnicities and things like that. Things that we were all familiar with, and something that we learned is that those are definitely communities that need help, but we also have to look into the other types of communities that are out there.
We're going to encounter challenges throughout our career. We're going to encounter times when folks don't want to work with certain populations, and we're going to have to be the ones who stand up and say, no, this is really important, and we will be the spokespeople for that effort.
This population isn't that different than the population you might treat in a county hospital. So these are really all part of our community, and I think that you guys understand that, and you'll be able to help open your cohort's eyes to the fact that this is an important issue, and I think exposure is the key.
Red when I gave